I'm your host, Dr. Nicholas Laloy. Today we have a very special guest, Dr. Jason Chiriano. He is an alternative functional medicine physician. Dr. Chiriano, welcome
Thank you. Thanks for
to
having me.
PI's Today's podcast. And today we want to talk about your specialty, where you were, where you are, and how did you take that journey. So tell us a little about your background, your studies, your academics, and what you've done in the past, and what are you doing today?
I guess to start with my background, I'm went to medical school in Pomona, Western University. I'm an osteopathic physician. I then went on to train at Loma Linda in general surgery, trauma, and vascular surgery fellowship. So I did that from 2002 to 2007 for general surgery, and then up to 2009 for vascular surgery. And then I worked at the VA in Loma Linda University for several years after that, and I worked trauma at multiple hospitals: San Bernardino County Hospital, Riverside County, Loma Linda. And then I went into private practice after that from like 2016 all the way up to 2021. And during that time, I don't know if you know vascular surgery, but we deal with very, very sick patients. Like it's the end of the disease spectrum, what we're dealing with. So it's a really palliative field. So we're not really curing anybody. And so I was doing probably like 80 cases a month up in the high desert. I was between a few different hospitals. I was getting pretty burned out doing that. And I was also feeling like I wasn't really helping people like the way I wanted to, because I was getting people so late in the disease process that it really started to wear on me a little bit. And in that process, because of my lifestyle, my health was also taking a big, it was becoming a big problem.
Correct.
So I was like 240 pounds.
Oh, wow.
I was pre-diabetic. I was on 7 medications. My cholesterol was through the roof. Wasn't sleeping. My adrenal glands were burnt out, and my traditional doctors were not helping me.
So it took a toll on you. So for our viewers out there, vascular surgeon, as it applies to the, let's say, PI world, um, every time somebody does an anterior, posterior 360 type of lumbar fusion, they need a vascular surgeon because they open up from the abdomen, and they need somebody there to make sure that the arteries, all the vessels don't get nicked or pulled to the side. It's a very, very selective and super specialty. So for you to make that transition as a vascular surgeon into functional medicine, and why this is important is because we're going to cover stem cells today, is how it treats traumatic brain injury patients. So then you got involved in functional medicine, and how did you start doing that?
So after I had to take my own health journey, and I saw what I could do for myself with alternative means of lifestyle and just looking at root cause. My mom was sick with orthopedic problems, and Kaiser wasn't really helping her. So I started treating her with regenerative biologics, including stem cells, and I actually got her better from an ortho standpoint. So then I said, well, between myself and her, I just kind of had this aha moment that I could really help transform people's lives in a more meaningful way. And so I started my practice in 2019 while I was still doing vascular surgery, and then slowly have transitioned into mostly doing functional integrative regenerative medicine. So
Wonderful.
it's, yeah.
And so even for me, I don't know stem cells very well. I hear about them. We have this, it's like a new fad that people keeps talking about stem cells, but really understanding stem cells, how many different types there are, what are they good for, how to use them. It is a little bit complicated, and there needs to be a little bit more of education out there. So, Doc, tell us, what are stem cells? What are the certain types of stem cells, and what are they good for?
Yeah, so stem cells in general are progenitor cells, so they have the capability of becoming, all sorts of different tissue, from cartilage to bone. From when we're born, we have stem cells in our bodies. From when we're developing, it all comes from stem cells. There's a lot of different ways that stem cells can be used and harvested. So, there's what we call mesenchymal stem cells. There's hemopoietic or umbilical cord stem cells. There's neuro stem cells. So there's a lot of different ways to get them. I think what you alluded to, this fad or whatever, or even the public's perception of stem cells is a little bit tainted because people still have this old perception that stem cells are obtained in a very unethical way.
Correct.
And they're coming from aborted fetuses,
Correct.
and they're very dangerous, and that needs to be corrected, because yes, when stem cells were first starting to be used way back when, they were using embryonic stem cells, which is another type of stem cells. So those stem cells were coming from undeveloped fetuses, and they had the potential to become any tissue in the body. They were very unregulated cells, and so they were actually finding that they were contributing to tumor formation and a lot of other bad consequences. But since that time, we're now very ethical in the way we get stem cells. They do not come from any aborted fetuses. For instance, you can actually patients can donate their own stem cells from bone marrow aspiration or fat aspiration, and then processed and then used for different applications, which we can talk about. But also from umbilical cord. So moms actually sign up and donate their placentas, and we harvest the stem cells from the umbilical cord, and then they're processed, cryopreserved, and then used for different applications.
Correct. And the type of stem cells you use, what are they?
We usually mostly use umbilical cord stem cells.
Got it.
Rare instances, we use some what's called Wharton's jelly, which is like the cushion of the umbilical cord,
Got
for
it.
some select applications. But in general, 95% of what I use is umbilical cord stem cells.
Yeah, and I've seen it on some people used, and I gotta tell you, it is, I would say, the miracle treatment or the miracle cure. It is, I understand every day it's still relatively new compared to medicine, things that have been come out there, but I've seen some really great strides with stem cells, especially in the elderly. I've seen it, things that would not work, and they've hit a dead end, and then boom, they get a few treatments of stem cells, and they get their lives back.
Yeah, it's really impressive, and I think the power of the stem cells, not it's not just in its capability to become tissue. It actually creates a whole biological systems modification in the body. So it has a lot of cell signaling properties. So it's decreasing inflammation. They decrease inflammatory markers like IL-6 and TNF alpha. They upregulate like IL-10 and TGA1 beta to actually improve the anti-inflammatory system. They secrete different factors like VEGF to help with angiogenesis, and so they're like the contractors where they're bringing in all these things to help your body heal naturally.
And when do you and when it's used for traumatic brain injuries, what does it do? What does it exactly do? Because that's going to be the question.
there's
So,
there's many different mechanisms it works for TBI, and I think when you're talking about stem cells in the context of TBI, you really got to look at the pathophysiology of TBI and to understand why stem cells are effective, right? So TBI is, as you know, is a multi-stage process. It's not just the injury, right? It's the injury, then it's the edema, it's the axonal injury, then it's the continued inflammation, and then it's the glial scarring, and then maybe trying to get some neuroregeneration there. So stem cells actually address all of those different phases of the pathophysiology. So if you think about TBI as like an earthquake, so the earthquake is the TBI, and then the city falls apart, right? So there's fires burning, there's electrical power lines down, their infrastructure is just completely destroyed. So the traditional therapies just kind of focus on maybe rebuilding some of the roads or something, or just getting people around, but they're not really rebuilding the city, right? Our traditional treatments. So the stem cells come in and they modify the inflammation. They're neuroprotective, so they decrease the amount of apoptosis or programmed cell death. They work with neurotrophic factors like brain-derived BDNF, which helps regenerate axons. And they also can help supply mitochondria to the axons. They actually transfer mitochondria to the axons to actually help ATP production. So it helps in all of those ways to create the whole new city, you should say.
and that's incredible because in traumatic brain injuries, we have very few treatments outside of psych and medication for psych, for behavior, mood. So this is revolutionary. This is something that people have some hope because I've seen this traumatic brain injury patients, and their physical ailments, is you know they can't do anything about it. because you can only be on so much mood stabilizers, or you can have so much talk therapy. So this is a huge breakthrough, and we thank you for bringing it into the traumatic brain injury field, because we don't have any treatments. Less than 1% of traumatic brain injuries is bleeds, and of course you can control the bleed and have the patient go to the ICU and so on and so on. But after that, we don't have treatment. So after somebody suffers with a TBI from an accident, what's the timing?
Yeah, that's a good
Is it an
question.
acute phase, subacute, chronic? What is your preference of treatment and seeing the best outcomes?
The earlier you can get them, the better, right? Because the properties of the stem cells, they help decrease the inflammation so much, which can help control like some of the later sequelae of the TBI. So getting them earlier is good. But I think there's a window for each part of the healing process, right? So you have the acute phase, which is day 0 to 7, essentially. And then you have like the next phase, which is the next couple months, and then you have the long-term problems. So when you get to the chronic TBI stage, then the stem cells really can focus on that neuroregeneration part. In the acute phases, it's really helping with the inflammatory conditions and the neuroprotection.
Excellent.
So I think there's windows both on early and late. I think early is really important, though. The problem is how do you get them early and plugged in? Because oftentimes they're still in the hospital, right? When I worked trauma,
Sure.
we saw the TBIs coming in all the time with the DAI, the diffuse axonal injury, and they're in the hospital and they are sick.
That's right.
Right. So unless you're going to smuggle stem cells into the hospital and give it to them, it becomes very difficult.
Well, I mean, we can't do it all, but we can absolutely help to
Yeah.
get them to you, and that's what this whole education and this podcast is about: is to people to recognize it and refer it. And a lot of physicians watch this podcast, and if you guys are listening out there, this is one of the only treatments that I've seen for traumatic brain injuries that actually work. So it's something that we need to pay attention to. As far as the application, it is intravenous.
Yes.
And it's a push. It's not in. Is it an IV or is it a pure push?
It depends what you're using. So for umbilical cord cells, which is mostly what we use, it's just a push.
It's just a push.
If you're using mesenchymal stem cells, you have to do it a little bit slower to make sure there's no embolization, which I would prefer to do umbilical cord stem cells.
I got you.
That's probably the best way to
Yes.
be using these. It's safe. It's very effective.
So it's like drawing blood, but the opposite.
Yeah.
Right? And it's very easy, painless, and very quick, I would imagine.
Yeah.
With the type of.
Yeah, it's very quick. I mean, there's a couple of ways you can do it. You can do it intravenous. There's some more invasive ways to do it. I don't think there's enough data to say which way is better, but you can do it intranasal, so you go right. You don't have to worry about the blood-brain barrier, or you can do intrathecal, which is
Yes.
it's probably best to do it intravenous.
Yes, I think the vein
Yeah.
is the best.
Yeah.
Nobody wants a
Yeah.
needle in the nose.
Yeah.
Wonderful, wonderful. And Doc, where is your location? Where are you located, so our viewers can see?
So we're in Rancho Cucamonga. We're right in Baseline Cornelian.
So you're in the Inland Empire.
Yep.
Okay, so for all those Orange County, LA, and Inland, and obviously the IE in doctor's practice is in Rancho Cucamonga.
And then we use the stem cells come from Kalbio.
Kalbio's
Kalbio, they're
okay.
excellent company, very reputable manufacturing process, probably the best out there.
Yes.
Very safe and ethical. Yeah, great product.
And that's huge. It is just like anything, where you get your product from it's the basically life or death in a sense that you want to make sure that it's very clean and very potent when you administer to the patient. Okay, great. Well, Doc, it's amazing having you on our podcast. I think everybody is going to be wondering, and they're going to have questions for us, and we will for sure support you and everything you do. We love functional medicine. We need more homeopathic and remedies in order for us to live better and regenerate. So thank you for all you do.
Well, thank you, and thank you for having me. It's been a pleasure.
Okay, thank you.
Yeah.